The chair now recognizes Mr. Jordan for 5 minutes.
Thank you, Mr. Chairman. Dr. Resnick, in your testimony, your written testimony, you stress that public health emergency authority is essential in the power of public health officials, state and local public health officials in making decisions. Should there be limits on the emergency powers of public health officials?
Yes, as I said in my thank you for the question, Congressman. As I said in my testimony, yes, there should absolutely be checks and balances and thinking these things through.
Tell me what those checks and balances should be.
Well, actually, Lawrence Gostin, a law professor of global health at Georgetown University, has some criteria that he thinks can think about for individual rights. And is there scientific evidence that the policy makes sense? Is the intervention the least restrictive possible to achieve our public health goal? Are the measures used likely to gain the public's support and confidence? Does the person have access to due process to challenge the intervention? And is the measure arbitrary or discriminatory?
Those don't sound like checks and balances. Those sound like guidelines and just good common sense. Checks and balances mean someone else has power, some other authority has power to actually check and balance the decision made by the public health official. What should those checks and balances be?
Well, again, I think keeping these guidelines in mind, and you're right, these aren't checks and balances, they're guidelines, but thinking that through carefully before you even propose the intervention, and then obviously having to balance those risks. And again, yes, the public health official shouldn't make the decision.
Public health official makes an emergency decision, emergency authority, and says this is going to happen. Should there be a time limit on that?
So those are good questions, but when we think about the illness and the situation that we're facing, right? So if you have smallpox, you have some kind of very contagious disease, there should immediately be able to put that into place. Yes. But
So are you agreeing with me there should be a time limit?
no, I think it depends on the circumstances. I don't think there could be one set moment that there's
Let's back up a
timeline.
second. Who should be able to check the decision of the public health official?
So you have the local boards of health, you have the elected officials.
Well, now we're talking. Yeah, it seems to me it should be the elected officials, right? That's how our system works. People who put their names on the ballot should make decisions for the people they represent, not someone who's unelected. So the check should come from the elected body. And I'm asking, what would be, for example, in the state of Ohio, I know what our legislature did. They said the public health order from the governor's office, from the state health director, there should be a time limit on how long that is in effect. Before the legislature, limited amount of time they can take that decision, but at some point the legislature gets to weigh in and say whether that's appropriate or not. Do you agree with that?
So again, I think it depends on the circumstances, right? So again, if you have a very contagious disease, no, I do not. So, but if it's a longer term thing.
You don't
yes.
think the elected officials should be able to overrule at some point the length of time of a public health decision emergency authority? A public health emergency authority decision, I should say. You don't think the elected officials should be able to overrule that?
At some point, maybe, but I'm saying in an immediate
Maybe?
emergency. In an immediate emergency where you have life and death.
I'm not arguing with that. I'm saying at some point, to your point, at some point, it seems to me at some point, of course the elected officials can overrule that.
Okay, I wouldn't disagree with that, but I guess the question is at what time point and when that would be. And
Yeah, and-
again, I think that would depend on the circumstances that you're facing, and there would be questions.
I think that
asked.
depends on the decision the elected officials make, not the unelected official.
But would you think that you'd need public health guidance and information and knowledge to inform those decisions?
We take guidance and that's why we have hearings. We take testimony from people. That's why you're here today. We're getting information. Of course, that's always part of the process. But in the end, you don't get to decide. The public health official doesn't get to decide. The people whose names are on the ballot elected to the state legislature, they get to decide. That's how it works in our system. Public health officials ever been wrong? State and local public health officials ever been wrong on orders they do?
I don't know for sure. I'm sure there's been cases, yes.
How about the recent one in New York? The state and local public health officials who said we should put COVID-positive patients back into nursing homes. Seems like that was probably wrong. Been nice maybe if the legislature got to weigh in on that and change that decision, people's lives might have been saved. We got all kinds of examples where that's wrong. Of course, we need the check and balance of the elected officials to make these decisions. You agree?
I also think there's emergency situations where they would have to act in immediacy.
No one disagrees with that. That's why the legislature gave them more emergency authority for a limited amount of time. But at some point, the elected officials get to weigh in. I see I'm out of time. I yield back.
Thank the gentleman for yielding back. The chair now recognizes Mr. Foster for 5 minutes.
Thank you. And